Adenoma detection with blue water infusion colonoscopy, a randomized trial. Introduction. Conventional colonoscopy with air insufflation, standard colonoscopy, is currently the reference method to detect and remove colorectal adenomas. It has demonstrated its efficacy to prevent colorectal cancer, CRC, and to reduce CRC-related mortality. However, 0.3% of patients undergoing colonoscopic surveillance will develop interval cancers related to missed adenomas. On the other hand, tandem colonoscopy studies have reported an adenoma miss rate between 16% and 24%. The adenoma detection rate, ADR, percentage of patients with at least one histologically confirmed colorectal adenoma or adenocarcinoma, as described by specialty societies, is considered the prime quality indicator in CRC prevention because of its significant link with the risk of interval carcinomas. However, ADR does not measure the total number of adenomas detected within a person, resulting in a one-and-done phenomenon. Yet, if an appropriate surveillance interval is to be assigned after baseline colonoscopy, it would seem important that all polyps are identified during colonoscopy. Although the risk of a diminutive adenoma developing into invasive carcinoma is small, the presence of 3 or more tubular adenomas predicts an increased risk of future advanced adenomas and CRC. The European Society of Gastrointestinal Endoscopy, ESGE, guidelines therefore recommend a shorter interval of surveillance for such patients. Consequently, the mean number of adenoma per patient, MAP, has been suggested in the literature to provide important information additional to the ADR about colonoscopy performance. Several factors have been considered as possible explanations for this adenoma miss rate, for example, lesions behind colonic folds, colonic spasms, atypical flat lesions, short withdrawal time, and poor bowel preparation. In the last 10 years, many endoscopic techniques have been developed to improve the ADR, such as water infusion colonoscopy, WIC, and chromoendoscopy. Chromoendoscopy, using indigo carmine, initially demonstrated controversial results with regard to ADR, but recently a large randomized study observed a positive effect. Combining WIC and chromoendoscopy is possible by using water colored with indigo carmine and is called blue water infusion colonoscopy, BWIC. Lung et al. Carried out a single-center study on American veterans in 2011 and reported an important benefit of BWIC on ADR. Larger studies in routine practice are needed to confirm this positive effect of BWIC versus standard colonoscopy on ADR and MAP in a non-academic setting that is closer to daily practice. In this context, we performed a multicenter randomized controlled study to compare ADR for BWIC versus standard colonoscopy. Background and aims. Colonoscopy is currently the reference method to detect colorectal neoplasia, yet some adenomas remain undetected. The water infusion technique and dyeing with indigo carmine has shown interesting results for reducing this miss rate. The aim of this study was to compare the adenoma detection rate, adenoma and adenocarcinoma, ADR, and the mean number of adenomas per patient, MAP, for blue water infusion colonoscopy, BWIC, versus standard colonoscopy. Methods. Lesne et al. Performed a multicenter, randomized, controlled trial in 8 units, including patients with a validated indication for colonoscopy. Symptoms: familial or personal history, fecal occult blood test positive. Consenting patients were randomized 1:1 to BWIC or standard colonoscopy. All colonoscopies were performed by experienced colonoscopists. All colonoscopy quality indicators were prospectively recorded. Results. Among the 1,065 patients included, colonoscopies were performed completely for 983 patients, 514 men, mean age 59.1. The ADR was not significantly different between the groups, 40.4% in the BWIC group versus 37.5% in the standard colonoscopy group. MAP was significantly greater in the BWIC group, 0.79, than in the standard colonoscopy group. For advanced adenomas, the results were 50, 10.2%, and 36, 7.3%, respectively. The cecal intubation rate was not different, but the time to cecal intubation was significantly longer in BWIC group, 9.9 versus 6.2 minutes. Conclusion. Despite the higher MAP with BWIC, the routine use of BWIC does not translate to a higher ADR. Whether increased detection ultimately results in a lower rate of interval carcinoma is not yet known.